Hello and welcome back to another episode of the Newbie Dentist Podcast. I'm your host, Dr. Omid Izami. In this episode, I had the awesome privilege of sitting down with one of Australia's premier dentists, Dr. Anthony Mack. Dr. Mack is a University of Sydney graduate and has also completed his Graduate Diploma in implants from the University of Sydney. Dr. Mack worked in some of Sydney's top dental practices prior to opening his own dental practice called W Dental, where he focuses on advanced restorative treatments. He's passionate about digital dentistry, indirect restorative, as well as implant dentistry, and has built his practice to allow him to focus on these procedures. Outside of clinical work, Dr. Mack is also a highly respected educator, running several courses throughout Australia on a broad range of topics, including adhesive dentistry and aesthetic dentistry. Overall, I found this interview to be filled with so many pearls that you guys will get a ton of value from. We talk about his journey into dental school, his first job, and how important it is to plan your CPD and your education and your mentorship to become a better clinician. We also talk about the importance of communication, digital dentistry, and with restorative dentistry as well. This episode is brought to you by my good friends at Henry Schein. With over 60,000 products available from consumables, CAD/CAM technology, lab equipment, and CPD events, you can always rely on them to be your trusted business partner every step of the way. As always, if you have been enjoying these podcasts, please be sure to pass them along to your friends, classmates, and colleagues. It also means a lot to me if you could head over to iTunes or the podcast app on your iPhones and give the show a 5-star rating, and please leave a review if you have some time as well. Lastly, I've been working on a large collaborative project with a fellow podcast host and my good friend David Keir. We will be announcing some exciting news in the coming weeks, but in the meantime, you can find us at foresightdental.com or on social media, via Facebook or Instagram at Foresight Dental. And that's the number 4, SIGHT Dental. Without further delay, I hope you guys enjoy my interview with the one and only Dr. Anthony Mack.
Hello and welcome to the Newbie Dentist Podcast, the safe place for newbie dentists to connect, collaborate, learn, and grow. The Newbie Dentist Podcast aims to provide high-quality and high-value content for all the newbie dentists out there. With your host, Dr. Omid Izami.
So I'm here with Dr. Anthony Mack, who is a dentist based in Sydney, Australia, who is doing a lot of stuff in dentistry in Australia. For those who are kind of overseas and may not be familiar with him, I'm sure you'll hear about his journey and his process and everything that he's done and accomplished in his career. So I do really appreciate you taking some time out of your busy schedule and coming to chat with me on the podcast today, Anthony.
No problems. Happy to help anytime.
So how we normally start these things is a bit of an origin story. So if you can rewind the clock for us a little bit, kind of take us back to, I guess for your days, it would have been like a Bachelor of Dental Science, maybe. So you're kind of going straight from high school to dentistry, if I'm not mistaken. Tell me a little bit about your mindset, like why you chose dentistry over like medicine or any other kind of field.
Oh, wow. That's a fair number of years now. Look, it's quite a number of years, but you know what? It's still fresh in my mind. And it's one of those things where as you get older, people, you don't realize that they still feel young at heart is because of these memories. So, yeah, I'm not sure if you got enough time to listen, but, when I went through high school, I went to what's called a selective high school in Sydney, and I did all my schooling in Sydney. And in our final year of study, I was just average sort of student. I wasn't the highest achiever or anything like that. I was good with my hands. I was quite good with some sports, like tennis, basketball, table tennis. I was, quite good with those things. And about midway through the last year, all of a sudden, all my friends says, "Oh, we're taking a day off." And I said, "Why are you getting a day off?" And he says, "Oh, we're going to go and sit for the GAMSTAT, the test for dentistry. Yeah. And if you do that, we head out to the city because that's where it's done." Yeah. And as a 17-year-old boy back then, the city was a pretty cool place. Yeah. And so he says, after the test, it's only a 3-hour test, and afterwards we can go out and play snooker and hang out in the city. So I said, "Oh, that's it. Where do I sign up?" So. Yeah. I didn't really know anything about dentistry. Like I came from a migrant family. My parents were just blue collar workers, and And, I probably only went to the dentist like 2 or 3 times up until when I was 17, so I didn't even know a single thing. Luckily, this test was really, you couldn't study for it. It's a knowledge-based test. It teaches you on everything, science, mathematics, English, and everything like that.
Yeah.
And there was about 60 people from my school out of like 150. I think there's about 60 people that went, because everyone just wanted to. Back then they said, "Oh, dentistry is really good. You do really well. It's a safe career." Blah 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 blah. And I said, "Well, I wanted to do economics. That was my goal. I was coming out. I did 3 in economics. I did commerce. I wanted to get into commerce, And so I sat for this test. And out of the 60, there was only 2 people that passed. And I was lucky to be one of them.
That's awesome.
And the other person that passed actually topped the state in the whole state. We call it back then HSC. I don't know if they still have HSC now, but that's what we call it.
Yeah.
And as part of that, you also need to get like a top 10% in the state to pass that. So I actually passed that part, which is HSC exam. I passed the GAMSTAT. The guy who topped the state, he went on and did medicine, because obviously he had the marks for it, and he's actually a neurosurgeon now.
Oh, wow.
So, and then back in those times, for us to get into dentistry, we actually then had to sit for an interview at the Sydney Dental Hospital.
Yeah.
There was a panel of 3, and then you have to ask you, like, why do you want to do dentistry? And I said, I had really no idea. You had to sit for a manual dexterity test. So you had to bend some wires. You had to make a wax tube. Yeah.
Yeah.
And then you also had to write an essay. You had to write an essay. And if you pass all that, they accepted you. So by the time I got through all that test, I luckily made it through. And then I still had my mind set on doing economics. I said, this is what I want to do. I love economics, the monetary policies, the fiscal policies. I love all that. And then my friends go, "You've got to be nuts. None of us got in. You're the only one that got in, and you're going to turn it down?" I said, "Well, I didn't know anything about it." I said, no, just do it. Try it out for the first. If you don't like it, you could always go back to do economics. Yeah. It's okay. I listened to them. Fine. So I got into dentistry. And it was the first year, I don't know if you went through, it was all science. We did biology, chemistry. This has nothing to do with economics, right? And so I did terrible. And I just got into uni life. I was sick of studying, and I didn't go to many classes. And people in my year would tell you I was the worst student. So anyway, at that time, we were still in the days where in dental school where a lot of people failed. Yeah. And I actually failed my first year. Oh, no way. I failed my first year. Yeah. And at that time, because the way dentistry is such a niche course, the way they scale the marks, I said, okay, well, I don't like this. I want to get into economics. Yeah. They said, no, you can't. You can't, because your marks don't show them. What do you mean? I got into dentistry. I got through, and you're saying I can't get back into it. No, you can't. So my marks in dentistry didn't reflect, was so bad that they didn't reflect that I was smart enough to do an economics degree.
Yeah, so it kind of held you back.
So I was stuck, basically. Yeah. So I was stuck. So I had to continue on with dentistry. And then I just struggled through the first year, second year. And then by the third year, all the hands-on stuff started coming in.
The fun stuff, yeah.
And I think, all the fun stuff. And then I think something kicked in. I said, if I don't concentrate now, I'm going to get kicked out of dentistry, and I wouldn't know what to do. So I just put my head down. I worked really hard, and then I did really well in all the clinical stuff. And then I had some good friends who helped me with all the exams and prepare for them and things like that. So I ended up coming pretty good. I ended up coming second, and I got the university medal.
Nice.
Yep.
It's a good turnaround.
Yeah, from last year. So and the guy who came first was he's a specialist endodontist in Sydney now. Okay. And so he's a very smart man. He's a very smart guy. So I was lucky, I think. And then I got out of dentistry, and I think this is where the real story started. I think I was very lucky. I had some really cool mentors. I was offered a really good job in the Central Coast, a really busy practice, but I wasn't sure about the experience I'll get. Yeah. And I ended up going for a really high-end practice. but they pay me peanuts, literally. I think they pay me the same salary as what you would get from as a dental officer, first year dental officer at the public hospital.
In the public system, yeah.
In a public system, and this was in private practice.
Yeah.
So, but I was looking for mentorship, and he was a great mentor, husband and wife, and he taught me so much. I still remember the things he taught me. So, and basically, I jumped into a practice that was doing like full mouth rehabs.
Wow.
They had CEREC back then, CEREC 3. Like I graduated and just jumped straight into adhesive dentistry, bonding. This was many years ago when, you think about now where it's still fresh. This was like a how do you say?
Like pioneers almost.
The pioneers basically. And so, I jumped into that. And after a year out, I was like cutting 6-7 onlays in my first year out on patients. Really? And doing CERECs, like all of them CERECs, and we were CERECing, and I was doing learning about tensing neuromuscular dentistry, and it was really good. And I was just very lucky because I had that first mentor, got me into digital dentistry straight away. Yeah. And he said the first thing was he sent me to America. He said, this is the best conference you can go to. It was the American Academy of Cosmetic Dentistry. Yeah. And back then it was massive. Back in those times, it was so big. And they said, you're a student, or you're a new grad. It was cheap. You can get there. And I went there the first year, and it was the biggest eye opener. We come out of uni learning, about cast posts and cores and amalgam crowns and things like that. And you go there, and they're talking about fiber post, bonding, and I was listening to these speakers saying, we were doing how to do veneer mock-ups, how to mock up in the mouth using the putty stem. This was 17 years ago,
Wow, that's really cool.
And we were learning, they were telling me you have to use rubber dam. You think I use rubber dams? We were learning back then, if it ain't dry, you can kiss it goodbye. Yeah. That's what they used to say. So, those things stick into my head, and, I came back with a lot of knowledge, and I did well. And then what I did was, I think I missed a lot on the emergency dentistry. I didn't do a lot of extractions. I didn't do a lot of surgery. I didn't get a lot of endodontics. So, back in my days, it was a little bit easier to find a job. So I literally went around into these big practices. I went down south, and I just asked them, look, will you give me a job? Yeah. And I told them what I did and what I knew, and some of them were quite impressed, and they gave me a job, and I was looking for experience. And I went down south and worked in Liverpool, in Sydney, and and I did that 2 days a week, and I was doing root canal after root canal after root canal, extirpation after extirpation. Nice. I was doing wisdom teeth. So I got a really good balance then. By about 18 months out, I was doing Sunday emergencies, facial swelling, kids with, had a baseball game, knocked their teeth out. Yeah. And then during the weekdays, I was doing CERECing, inlay onlays. So, that's cool. And then I decided that I moved on, and then I found a job. The practice manager who was working with me at the time, she moved, and she worked with a guy, I'm not sure of the guy by the name of Chris Ho. Yeah. And then Chris was looking for someone, and she recommended me. And so I went and interviewed with Chris, and because Chris knew what we were doing, he had a CEREC machine. He knew I was doing CERECs and stuff, so he gave me a job. Yeah. And so enough, I started working with Chris, and then things sometimes just happen, So I learned a lot about CERECs and full mouth rehabs as soon as I graduated. I was CERECing. And then I was doing a lot of emergencies, wisdom teeth and things like that. Wisdom teeth, endodontic. I was doing a lot of molar endos. Yeah.
So let me, before we kind of move on, let me kind of just dive into a few of these things a little bit deeper. So, that's incredible. You're 18 months out. I've been out for 2 years now, roughly. Luckily, obviously, the job situation is a little bit different maybe now in terms of how busy new grads and things can be, and how much exposure they can get to certain procedures. But how did you have the clinical confidence to, start doing full mouth rehabs, start doing wisdom teeth, start doing endo, all these things that are a little bit maybe more nuanced, a little bit more specialized, if you will, and have confidence that I can deliver this, I can do it at a high level, seeing that you're such a new grad and such a young dentist?
I think it was, like I said, it was my first job. How I can say the first job that you pick is probably what sets and defines your career. And that's why I tell the students it's so important to find a really good mentor. And I had a really good mentor where every Friday, the wife, they were really strong in communication. I'm not sure if you heard of NLP or neuro-linguistic programming. Yeah. Yeah. So they were really strong in that. And so every Friday they'll use, as part of my mentorship, not only did they, send me overseas to the right courses, they used to sit down with me and go through cases. So they actually sat down. I actually present cases. And one of the first things I knew was they made me do a lot of photos. We were taking digital photos, like full series photos, maybe 18 years ago, which was pretty new back then, So we were taking full series photos, we were charting, we were taking x-rays, and then I would go and sit down and I'll go through these cases with my mentor. And we'll talk about how we're going to present it to the patient, how we're going to tell them the pros and cons. I was learning about sowing the seeds. Like, you might not win every case, but if you sow the seeds now, they will eventually come back once they realize it, when something goes wrong. So I learned about that. And I used to watch. I mean, we weren't busy all the time. We might be seeing, 4 or 5 patients a day. Or the other time, I would just jump into my mentor's chair. I'll literally assist him. I literally would be sitting there and assisting, because that's the best way to learn. You're sitting there, you're assisting him, you're seeing what he's doing, you learn so much about it. And I think, and they gave me the confidence, because I knew I had their support. I knew treatment planning is really important to know how to treatment plan and communication. I then, before I brought the patient back, I knew exactly what we were going to do. We knew exactly what our options were. And we actually sat down the patient now for half an hour just to go through their treatment plan and go through the photos. And then, and then decide, look, then we learned whether they want to do the whole thing or they want to do some of it. I learned a lot in that one, and I learned a lot when I was Chris's, where Chris taught me, you can always do something for someone, you don't have to, not every case needs to be a full mouth reconstruction. Patients shouldn't feel that they leave there, that they need, if it's not a full mouth, they can't have anything done. You know, and I think this, one of the things I want to share is that you can always try to do something for someone. You can give them the options. If they can't afford it, don't need to drive them down that path. Just do a simple filling. The most important thing is to gain the patient's trust. And how we've done what we do now is trying to gain their trust, because, when you go and buy a car, when you go and buy a car, do you go and buy the first car that you go and get, that you see?
Definitely not. I do a lot of research, and I know when I go into the dealership what I'm after. So I have done a lot of homework to go in.
Are you going to trust the first salesperson that's going to sell you the car?
No, you're a bit skeptical.
Exactly. The first time you go to your hairdresser, are you going to trust him with your hair devoutly, like do the full color and everything like that?
I haven't colored before, but I guess I wouldn't. I would go to maybe a dentist or a hairdresser with a good reputation.
Yeah, exactly. So, as a new dentist, your patients are probably not going to trust you completely first, and trying to sell a very expensive treatment plan, they're probably not going to want to dive in. But if it's something small, they might just give you a go. They might say, oh, if it's just a filling, okay, well, let's see how you go. They're testing you out, and if you perform well, they probably will come back again. So I think, we always start taking baby steps. Once you gain the trust, see those patients for after a while and they trust you, they're going to go ahead with the crowns or the onlays or the root canals that you treatment plan for them. I think is just as much as we need to trust the patient, they need to trust us as well. And I think once you gain their trust as a young dentist, you will find that it takes time, and you see me doing what I'm doing now, Amid, and you know what? Another 10 years time, you'll probably be just doing just exactly the same, and I think we all walk a very similar path, and people who have the passion to do this in dentistry and you love what you do, you'll be doing what we're doing.
Yeah. So someone listening now who's a new grad, maybe they're not as so lucky. It's nice because like I mentioned to you in the pre-interview, like a passion of mine is like high performance and why certain people kind of accomplish more than others and why others kind of stay average and stick to what they're comfortable and stay in their comfort zone. So a lot of the people I've interviewed who've done quite well have been like you. They've been lucky. They've got their first job. They had good mentorship and they kind of had that good mindset though. I think the mindset is very important because a lot of people may get into maybe a high-end practice and they're not busy and they get frustrated and they want to just be busy for being busy sake and maybe not take the opportunity to learn or go assist like you did and learn. And I've found these similar parallels with like a lot of people I've interviewed. So I think it's like a very obvious like pattern and trend that's kind of developing. And
it's not a secret, is there? It's no secret.
So my question is, I guess, for a new grad who maybe, even in Australia right now, there's a lot of dentists that are working, they might even be in corporate situations and they're not really busy or they don't have a mentor that's with them all the time. What kind of advice would you have around that kind of space and how they can maximize their situation to learn as much as they can?
Look, I think you need. Look, that's a really tough question. I mean, because everyone is different, and it's very hard to understand everyone's situation. And that's why we are where we are. But my recommendation would be that if you're not finding, if you listen and you see everyone's doing it this way, you want to do this, then you need to go out and look for a job that will give you this.
That's great advice.
Go and like you said, go into these conferences where the bigger dentists go. Rather than saying, "Oh, it's too advanced for me," go and learn. You can always learn something. Those complicated courses and things like that, those conferences you always, number one, pick up something, right? Number two is that you probably meet a lot of the dentists who are doing that kind of procedure because they want to learn.
Great tip.
So you get to go and meet them and just say hello. Find your rep that looks after you and see if she can introduce you to some dentist and just speak. Look, I'm looking to learn this. I'm looking for practice that can help me to do this. I've got the passion. I really love doing this. This is what I've done so far. And you know what? You just might bump into a dentist that is looking for someone like yourself, and that's willing to help you. And even if he can't give you a job, I know there's a lot of dentists who'll be happy to support you with just cases. Like I said, people send me cases and just say, "What do you think? How do I tackle this?" There are a lot of people who may not be active on the younger social media sort of circle, but who are very willing to help.
Yeah, for sure. So I think you just have
that's what I would recommend. Yeah.
Yeah. And I think that's a great recommendation, a great tip. And I think that's something that we're really lucky with our generation is for those of us that are like pretty proactive. It's pretty accessible. I mean, with Instagram and with Facebook and all the dental groups and things, to just reach out to someone and be like, "Hey, I don't have a mentor at work. Do you mind if I ask you something or bounce a few ideas off you?" And I think that can go a long way. But I think it comes down to mindset first. You gotta want it enough to kind of go after it. So, tell me a little bit about the kind of bigger picture now. For a lot of us, like myself, because I'm selfish in my interviews. I want to get tips for myself. Really, is you're a couple of years out now, and you've kind of dabbled in a little bit. You've done maybe a couple of veneers, you've done a couple surgical extractions, you've done a few onlays, a few crowns, but you're not really like a specialist or very confident in these kind of disciplines. What was like your strategy? I know obviously I was, one of my questions I was going to ask you is like, what was your first big case? And maybe we'll get into that, but it seems like off the bat, you're doing full mouth rehab. So a bit of a exception to the rule there. What is like a strategy that you had for CPD coming out of school, or even as soon as the earliest memory that you have is, okay, maybe this year I'm going to focus on this and I'll take courses, and then the following year I'll do this. Did you have any sort of like strategic plan for like the first 5 years of your career?
I sort of did, but I think that plan is sort of change, the way I feel about dentistry now, and obviously be doing what I'm doing now, and having a lot of young associates and recommending them. I'm a very strong believer in doing your CPD strategically.
Yeah.
As well, in terms of what you want to do. Now, some people might want to do, like a lot of surgery. They might just want to do implants. For example, like, David Attier, you can see his posts. He's just doing a lot of amazing implants. So he's just going to dive in to do that kind of stuff. And that's what he enjoys. Great. Other people, like you see, might say, I want to do veneers, then you want to dive into that sort of thing. But, in general practice, let's say if you're in general practice and if I had to nail it down, I really would recommend people to start with the fundamentals. We need to get really good with our anterior composites, because anterior composites are ones that you're going to probably sell easily, or you're going to be able to get case acceptance easy because it's not a high cost.
Yeah.
Everyone talks about their front tooth. Now, if someone breaks a tooth and you do a beautiful composite, what do you think they're going to go when next time they're going to go out? Oh, I went to a dentist, he did a beautiful job on my teeth.
Yeah.
And that's going to get you a lot of referrals. But if you do the terrible composite, what is he going to say? I went to this dentist, it was cheap, but I hated the composite that he did. So he's never going to come back. So I think anterior composites is number one, and posterior ceramics. So always a firm believer in if you can do good posterior ceramics, because there's so many broken teeth, old amalgams or failed big composites, root canal treated teeth. They all need good indirect restoration. And if you can do good indirect restorations, we know that they last well, they're strong, they're financially remunerated well. And because of that, if you can do good at those and you can get good case acceptance, you're going to build a good portfolio. Because once someone's had a root canal with you and they've then done a crown with you, they're not going to go in as well. They've just invested themselves to see you, right? I mean, if they've spent $2,000 on a molar root canal and then another $1,800 on a crown, do you think they're going to go and shop around somewhere else? No. If they have a problem, they're going to come back to you, aren't they? So I think if we get really good at that, that's a really good step. Root canal therapies, anterior composites, and posterior ceramics. I would say those are the fundamentals.
That's the bread and butter.
And maybe treatment planning. Yeah, you need to be good at the bread and butter, because aesthetic work comes I mean, look, there's a lot of practices that were advertised for that. In our practice, all our practice are sort of word of mouth. So our aesthetic work comes within our existing patient base, and also people that have been referred in as well through word of mouth. So we find if you get the good bread and butter, well, all the aesthetic cases will come, because those patients where they probably were only testing you for the fillings will then 6 months later come back and say, look, Anthony, I don't really like the crookedness of my teeth. What are my options in fixing it? They wouldn't ask you when they first met you, but they'll probably ask you 12 months down the track. That's where you start to pick up a bit more of those aesthetic cases. So in those mindsets, once you're good at that, then you start to pick up some more of the ceramic course, go to like some preparation course, learn about veneers, learn about bonding, and if you're good at bonding, you're good at veneer preparation, you're good at treatment planning, those cases will come. I always believe, a strong believer in learning orthodontics.
Yeah.
So you really need to do orthodontics. And I was just about to say, when my story was after 18 months, I was very lucky because I had a friend who was in my year who was working with Derek Mahoney. I'm not sure if you know a guy, Derek Mahoney.
Sure. Yeah.
One of the most well-known orthodontists in Australia. And he loved orthodontics so much that he decided that he wanted to do a master's in orthodontics, and he had to go to Hong Kong to do it.
Yeah.
And he was a good friend of mine. He called me up and says, look, I'm leaving this place. Do you want to learn a bit about ortho? And I said, I'm not sure. I'm into CEREX, I don't know about ortho. He goes, just come along, come and watch me. We'll do it. Yeah. So I literally just dived in, and then, I took over his job, and I was working with Derek Mahoney for 2 days a week.
That's amazing.
And I did that for 5.5 years, and we were seeing 40 patients a day, anywhere from start to finish. So, Derek taught me all about orthodontics, and, and then I was with Chris, I learned about implants. So I did my grad dip, and I was seeing him doing all on 4s and all on 6s, and I was helping him, fix up emergencies like broken temporary implant prosthesis. So, I was lucky. I was the right place at the right time.
I like that you're humble, at least, and you just attribute it to luck. Because you're working with some of like the biggest names like in the field. Surely there's more to luck than that's amazing. So you had a good mentorship with restorative with CEREX, and then you work with Chris Ho, implants and more prosthodontics type work, and then Mahoney for ortho. That's pretty good.
Yeah.
So tell me, obviously there's always the positives. If you don't mind sharing, maybe, because I know a lot of us new guys deal with like complications or a procedure doesn't go as planned. What was that like for you early on in your career, and how did you what coping strategies, how did you kind of learn to manage those and deal with those?
You know what? The best way to learn is sometimes, and unfortunately, is learn from our mistakes. I'm sure you've made a mistake before, and you always remember in your head, right? And I have to say, I can tell you that my first onlay that I ever did, I still remember it today. I still remember the patient's name because I didn't bond it properly. And the patient ended up getting a lot of sensitivity afterwards. Yeah. And he kept coming back, and I didn't know how to treat it. And back then, when we came out of dental school, they said, how do you treat sensitivity? Oh, you just apply a bit of Durafat, right? Yeah. So I was applying Durafat for this patient for about 2 or 3 weeks. It came back. It hasn't settled there. Hasn't said I was getting sensitivity. I didn't know how to treat him. And then he ended up, and to be honest, he ended up going somewhere else. Yeah. He went and sought another opinion. And the guy then said, no, something's not right. He crowned the tooth. Basically, he ended up getting a crown. So from that day, I really learned from my mistakes, and I knew that I never would make a mistake in bonding and restoration again. I went to ACD, and I learned a lot about bonding and adhesive dentistry, and then I came back and I was doing rubber dam and rubber damming everything, so you learn from your mistakes. So I guess, the thing is, we all make mistakes. I make mistakes, and I'm sure every specialist has made mistakes. But the thing is to learn from them and don't get your heart down and have another go. And one of my first mentors said, you don't have to fear what you don't know. If you don't know how to do it, you just need to go and find out how to do it.
Oh,
you go to your courses, you learn how to do it, and then you start with baby steps.
Yeah. Do you have like new grads or like young associates working with you now?
Not new grads. I have some younger dentists. They've been out a little bit. So, I have a few. So we have about 2 or 3 younger dentists that works for us, and they're fantastic. So, they do really well, and I hope they're happy. Sometimes I'm not always there because I'm busy in practice as well. But whenever I'm there, I'm welcome them come in and share cases with me.
Yeah, that's awesome. So tell me a little bit about the digital dentistry, because I know that's like an area of like passion for you. And obviously you had exposure early on with CEREX and things. What's that meant to you sort of in the last few years? Like, how do you apply like digital dentistry to your like day-to-day practice right now?
Look, I would say 99% of my work is digital dentistry. Like it's all, we don't take, what do we call digital dentistry? Well, let's say the most common thing is a replacement for an impression. Yeah. So we find, most of our work, we don't need to take an impression anymore. In only very rare cases would I take an impression. So it's really formed, when you get used to something, you never give it up. Have you ever used the wand before to give anesthetic?
No, I haven't. I've heard great things, but I've never had the
it's
experience.
Like I when they first came out, we were lucky to get to use it at Chris's, and once you start using it, you never want to pick up a syringe again. It's just a creature of habit. And digital dentistry is going to be like that eventually. At the moment, I think the reason why the uptake is a little bit slow, it's just cost. Obviously, it's a big expense. And people, worry that they can't get the same result with what they would do with analog. And I think it's just about having the right team, getting a good technician that knows digital dentistry to do because we're obviously talking about indirect restorations.
Yeah.
But I think it's a very important part. And I think you guys are in a generation where you can dive right in. For those who are lucky enough to work in a practice which has CEREX or Trioses or Iteros, that's great. But for those ones who aren't there yet, you don't have to panic because it will come. Yeah. If you want to do this, you may need to go to find another place which may have a scanner to do it. And scanner's going to get so cheap that you might even be able to buy one yourself, invest it in yourself, and just carry it with you wherever you go.
Practice. Because I have the ones that just connect to laptops, right? The USB scanners and stuff. You don't
correct. They all nowadays all run off a nice gaming laptop and the Alienware. So it's a big expense, but it's like, when you first bought your pair of loops, that was a big expense too, wasn't it?
That's right.
And you wouldn't work without it.
Yeah, for sure. So do you still use CEREC a lot? Are you still milling in the office, or you just scan and send it off nowadays?
Yeah, look, I scan and send off nowadays. Obviously, for me, every practice is different. I went from a practice where I guess to tell you my true story is that I worked in practices which had CEREX. Yeah. And when I went and started my own practice, I just didn't have the money. I can tell you, we started our practice, 2008, and we started in May. And then the GFC hit in August, and by November, I was almost bankrupt. We had, between me and my girlfriend, or my wife back then, my wife now, we only had $5,000 in our bank account, and we had mortgages to pay and practices to pay, and we got through that, and it was just too expensive to buy a CEREC at that time. So I sort of got used to not having one. And then when I started doing this, I just worked with a great technician who I trust. So it's just a default for me just to buy the scanner and let him do all the beautiful ceramic work. So, but for people who don't have access to that, a CEREC is fantastic. I started with CERECs. They work really well.
And now a short ad break from our sponsor. Henry Schein is proud to distribute GC products. They have a wide range of restorative products, including Genial Universal Flow, Genial Universal Flow X, G Premium Bond, and Ever X Flow. All of these products are products that I personally use and love, and also Dr. Anthony Mack uses them in his dental practice as well. To view these products or to make an order, visit www.henryshine.com.au. Yeah, no, it's cool and it's fun to play with. I'm lucky in that sense. I would do one day in the country and we have a CEREC machine there. So it's fun to do that. And one of my other places that I associate at, we have iTero scanner. We got a 3D printer and stuff. So just kind of trying to get, I still have some like trust issues with like deeper margins and scanning it. So sometimes I just take a backup PVS anyways and send it off. But I think it's cool. You see the wow factor in the patient as well. You can scan them and just show them the 3D scan of their teeth, especially with like Invisalign and things like that, the simulators. And
trust your scanner, man. You got to trust it. You can actually magnify it. You see if you can see your margin in your scan, the technician should be able to find it as well. So one tip is if you're doing scanning is to keep your retraction cords in. So if your retraction cords are in and you can see your margins through your loops, your scanner will pick it up. Okay. So don't take it out. We get taught, the double cord technique. And then you take one cord out. Scanners don't like dark spaces. They're all light scanners. So if you create a dark space for them, they're not going to read it. So the point of the cord is to retract the gums out, and then it will still pick up the color of the cord. So actually, you've actually took away that dark space, and you've given them a depth for them to actually correlate. So by keeping the cord in, you actually and exposing the margin, you actually get a better scan.
That's a great tip. I'll try that for sure. Do you ever, something I kind of came up with and it's been working relatively well with iTero's scanning with the rubber dam in place, like for the single tooth and then take the dam off to finish the quadrant because you already have everything retracted. And so I thought it was like a pretty cool trick. So I don't know if it's that useful, but it worked out pretty good so far. Yeah, look, I've seen people do it. They scan with the rubber dam on and then they take it off and they just scan the soft tissue, and I have no problems with that. It's just, you just have to, for me, it's just like having to scan twice, that's all. But there's no difference when you taking, I always like to sometimes just check my margins by taking the dam off, because sometimes with rubber dam, I find that you can't see everything, in relation to the mouth. So I find sometimes I see my margins a little bit better once I take the dam off, because maybe if I too deep or not deep enough. And so I like to just finish my margins, fine finishing without the dam on. Okay. But for an inlay onlay, definitely with the dam on is perfect. Works well. Yeah, that's great. What about, I know you did grad dip in implants. When did that implant kind of journey? I know you were working with Chris Ho's doing implants, that probably led you into it, but what made you decide to like get a formalized, like program or master's kind of under your belt for that? I think at that time I moved into Chris's practice, and I obviously went there because I wanted to learn about implants. And at the time, Richard Chan was a big influencer at our time. And Richard, who no longer practices anymore, but he's still an influencer in terms of dental implants. And Chris did many years with Richard, and so I wanted to learn about dental implants. So I was doing a lot of the Noble Bar Care courses and things like that. And Chris said, look, if you want to do this seriously, you should really consider doing the Graduate Diploma, because that's what he did. Yeah. And so I applied and I was lucky to get in. At the time, only Sydney Uni offered it. No other uni offered it. So I was very lucky to get in. You had to show that you've done some parts in implants. You had to go through interviews. And so I got into the grad dip and it took me about, I think we finished it in 2006, I think. 2006, I finished it. And it was great. You learned a lot about the didactics and the evidence base behind implants. So, and obviously we were seeing the cases at Chris's. So, he's such a good mentor. I watched so many cases through there, and you learn so much. And I guess that was then formulated part of my practice doing dental implants. Yeah. So what do you enjoy now, like in your given week? What kind of procedures are you doing the most of? Look, I think, I'm quite lucky now. I mean, I have a practice which is pretty busy, and I do a lot of prosthodontic work. So I'll do a lot of my bread and butters. I do a lot of onlays, do a lot of ceramic work. I do a lot of, now implants. I do, I don't do I don't get those massive cases. I get a lot of single units, short spanded implant bridges, but I get a lot of the ones where, you have to do some crowns and then the implant. So, my perfect day would be where, I prep, maybe 3 or 4 crowns in the morning, or maybe I do prep 2 crowns and 1 implant. And in the afternoon, I'll be fitting, 2 or 3 crowns. And then I'll do a couple of consults. And then that would be my day, and it's good production, and yeah. That'd be a good month for me.
So no, look, I'm lucky that we've got a good practice now that
Yeah.
most of my patients are a little bit older as well, and sort of the baby boomer stage. So
Yeah.
they're needing that a lot of work. So that's most of my work these days. Yeah, I do some I used to do more orthodontics. I don't do as much. Still do some Invisalign. So I do a lot of ortho restorative cases.
Yeah.
I still do a lot of my root canals. So I still like doing root canals. So I do a lot of root canals.
Yeah.
And when you do the root canals, you always finish off with the indirect restoration. So it's always good.
Yeah, it's a nice combo there. And how refined are you in your like cementation appointments? Like how efficient? Like how much time do you spend doing that?
Yeah, look, if I'm bonding and onlay, I always leave myself 40 to 50 minutes.
Yeah.
I leave myself 50 minutes because, I always want to have a chat with the patient. Then I'm going to numb them up. Then I'm going to rubber dam. Going to pop the temporary off. Then I'm going to clean the surface. Then I'm going to try the onlay on, make sure it fits, check the contacts, check the margins, check the, if I need to check the occlusion before the dam. And then my nurse will prepare the ceramic surface, and then I'll go in and micro etch the tooth. I'll then bond the tooth, and then I'll bond the tooth restoration in. And by the time you finish, you're at least 40 minutes. And then, and I give 10 minutes for my nurse if case something's not right, you might need to adjust the contact, you might adjust the margin. And that extra 10 minutes for my girls also to change over the room, that 5 minutes to change over the room, talk to the patient, make the next appointment for the next one. That's always good. The patient should always walk out with a next appointment, even if it means that it's a 6 monthly appointment, you should always keep in touch with them. So that's pretty much it. That's my protocol, about 50 minutes, I would say.
Yeah, I think, it's funny. I was talking to a few friends of mine about how like we're getting slower and slower at dentistry because I feel like I was like much faster when I was like first graduated, and now I'm like painfully slow. But I think it's good. You want to do good work.
You're more careful with your work. Exactly.
Take pride in what you do. And I think one of the cool things, is a little bit maybe shallow, is like with Instagram and stuff, because we like to post cases every so often, and you want it to be like perfect, right? So I think it makes you a better dentist in a lot of ways, which is pretty funny.
And that's a lot of pressure for you guys. Everyone's looking for that next best photo, isn't it?
That's right. So tell me a little bit about sort of like this. When all this side stuff coming in, I know you guys, you just had Encompass, which was a massive event and a massive kind of success. And I kind of missed out and I was kind of upset. So definitely I'll be at the next one. And I know you have like a restorative masterclass that you do with Smithson and Mac, which is a cool name, by the way, put together. So tell me a little bit about the side stuff and when that kind of started off for you in the journey.
Look, I think I was started off in about 2010, 2011. I just started my practice and I was very lucky enough. Some reps knew where I come from, like working with Chris and Derek and things like that. And so, they come and obviously want to sell you some composites and things like that. And, they ask you, can you send us some photos? So I just sent some photos of my cases, and back then photography wasn't as big as it is now. Yeah. And they liked it. And I think at that time, GC said, look, they wanted to start they've never run composite courses before. They've never ran a single seed course before, So they said they want to start doing composite courses and would you be interested in helping supporting us? And I think I did my first one in November 2010 or 2011. Yeah. And then I was pretty fresh then, and then they've supported me, up to now. So, I do a lot of work with them, but we started off just doing them for the ADA, did a lot for the ADA. And then I worked with a company, and supported a company called Dental Ed, who used to bring people like Pascal Magnier and Galip Gurel, who are, for us in my era, like legends of this. And they used to come to Australia and I'll be in the background supporting them and learning as well. I would get to sit in, I wouldn't have to pay for it. So I've been in there as well. And then like people like Angelo Putiano and Mauro Fradiani, they all came through Australia through Dental Ed, and I was lucky to meet them and pick their brains and work through them. And I think and then I started working with a guy called Andrew Chio in Melbourne, and he was doing a lot of this stuff with me, and he's a great friend. And the only way that we could find things where we could do it together was to do it ourselves.
Mm-hmm.
So that's when we started just trying to piece the puzzles together and trying to do it ourselves, because it was more for us to hang out, because he's based in Melbourne.
Yeah.
I'm based in Sydney, and we really enjoy hanging out with each other. Well, how can we find time going to courses together, or maybe doing a couple ourselves? So, that's how we started, and we've been great friends since then. And that was the reason, really, was just to find time to spend time, have some fun, do what we love to do, and catch up, I guess. Yeah.
One of the things I'm realizing now is like the time factor. And I think it's a big problem with us millennials is we're very impatient, and we want things to kind of happen very quickly and come about pretty without maybe necessarily putting in the time or the work to kind of get there. So, because when you go through the school system, like you're used to like, okay, I'm like in first year, I'm in second year, I'm in third year, and you're used to those incremental changes in your life. But when you kind of graduate and you finish school and you finish dentistry and you enter the workforce, apart from like the tax cycle, there's not much else that kind of keeps you like perpetually kind of moving forward. So I think that's one of the main things that I asked you earlier was, did you have a plan in place for your CPD and things? Because I think it's very important for us to have some sort of a plan in place. So we're not just kind of like floating along and before you know it, 3-4 years has passed by and you're just still doing your class 2s and haven't really learned any new skills or haven't really added any more techniques. So I think it's very admirable, and I think it's cool to chat with you because I know, obviously you've been through the journey a little bit. You're a little bit further in the game than a lot of the guests that I normally have on who are, maybe 3, 4, or 5 years out of school. So, and seeing the same trends and the same patterns of, what it takes to kind of be successful, what it takes to, achieve more than, what the average, I guess, dentist would achieve in your career. And one is, I think what I'm learning is obviously there's no substitute just for hard work. And 2 is you need to like really seek it out, seek out opportunities, seek out mentors, seek out good jobs. Like you said, if you're not in a job that teaches you what you want to learn, then perhaps you got to kind of move on and find something else to do or find a new job.
Yeah, don't be shy. I think it's don't be afraid. It's things are always new for us. We're still learning, and there are things that I'm never done before, and you got to just take that plunge. I mean, you got to do it for yourself, and and the people who are going out there and just be open, honest, and don't be afraid and learn. Like, join some study clubs. Study clubs are always really great. I mean, look, they're not as big now because there's so much social media, and we're finding that the younger generation aren't going to these study clubs because they feel that they can get a lot of stuff online. But study clubs is actually a really good place to meet the local dentists around your area. And you actually can meet them, and you find support in them. You can find mentorship in them. And you also find a lot of the specialists in the local area are at these study clubs as well. And they're going to act as your mentors. If they see your work is nice, they'll actually refer you work as well. So, don't be afraid to join these study clubs, because the study clubs are really important, I think. And it's a place where you can actually interact, and you might find your next mentor there,
That's right.
So, but I guess that's a little tip, I guess.
That's a great point. I know when I was living in Canada, it was a little bit more emphasis on study clubs. I don't see them as much like in Australia or Melbourne, or like really recognized ones that people got. Like in Canada, we have like I think it's like the Toronto Crown and Bridge Club, and there's like a 2-year wait list to get into this like study club. So,
wow.
So those things are kind of big. I kind of started off last year at a newbie dentist like study club, sort of serving the same line with the podcast. I had an event with Dr. Varun Garg, who's a prosthodontist in Melbourne, and Bharat as well, who you know. So that was fun, and I think it's fun to kind of get these things together because, like you said, Instagram is great and Facebook is great, but you lose that face-to-face interaction, which you kind of get when you go to courses and when you go to study clubs. You get re-energized, kind of you see other people and what they're doing, and it's kind of
just
motivating.
a balance. Yeah, it's just you get that balance. You can find stuff on social media, but it's also good to meet people face to face and share stories. And
absolutely,
you're young, you don't have family commitments. You just go. I mean, and they're also not too expensive. You might pay, I think, $300 or $400 for a year subscription, and you get usually 3 or 4 dinner meetings. So it basically covers your dinners, and that's pretty much it, really. And it's a nice place to go to. I think that I highly recommend more people should join those.
For sure. Absolutely. So, last thing I kind of want to touch on, and I know we've touched on it a little bit already, is maybe just some general tips that you might have. Like if you have a new kind of younger associate working in your practice, who comes to you and says, okay, I want to, get to where you are, for example, in my career. What main kind of tips would you give out to them?
Look, I think my main tip is that stay focused. Obviously take baby steps. Like you see a lot of people who've done well or so very experienced. We didn't do it overnight. So the challenge is, I know that there's a challenge to race there, but you will find that if you take small goals, you will find that your journey will be pleasant. Do the things that you enjoy. What else is there? Communication is really important. Like patient communication is really important. And one of the things I learned is that, show empathy, because if you can show empathy and you actually do the right thing, sometimes, we think we're smart. We've done dentistry. We're pretty smart. And we know things and we can sell things to people.
Yeah.
But you know what? Our patients are probably a lot smarter than us. Some of these guys are corporate guys, CEOs, business owners, or retirees who's had a whole life experience about us. They can pick someone selling them from a mile away. And I find that when I actually show empathy and actually say, hey, is this what you want? Okay, well, then we don't need to do an online. We can just do a composite. You just want it as a temporary? Let's just do a simple filling. You know what? They go to me and say, wow, thank you for that. I went to 2 other dentists and they just tried to sell me something, but you actually didn't. I said, well, there's no need for me to sell this.
Yeah.
This is what you want. And if you show empathy, you'll find that you can win the patient over, and then they'll trust. Once you have trust, they'll let you do anything that you want.
Yeah. That's
a big tip, I think.
That's huge. Yeah. That's a great point. Trust is, it's hard to earn and like easy to lose, as they say, right? So
very exactly. You hit it nail on the head, so you got to earn that trust. And the best way to do it is just to show empathy. No one expects you to be perfect. If you're not strong in something, just say, look, I would love to do this. Look, I know I'm comfortable with it. If I'm doing a procedure, it's pretty tough. I usually tell the patients, look, I think it's within my comfort zone. I can't guarantee success, but I'm also happy to refer you to a specialist if you feel that way. But I think I will be able to manage this case. But if at any point in time I feel uncomfortable about it, I'll be sending you to the specialist straight away. Yeah. But at the end of the day, it's your call. And you know what? 9 out of 10 of my patients, if they trust you, they say, Anthony, I don't want to go to a specialist unless I want to do it with you. Yeah. But if you feel that I need to, just send me there. I'll be there. I don't mind.
That's great.
But that's because they got trust.
Yeah, and that upfront honesty is great. And as a young dentist, I'm learning that'll save you a lot if you're open and upfront. If instead of just going into it and like, yeah, I got this, and then something goes wrong, then it's a whole different conversation altogether. So
yeah, no one expects everyone to be perfect. I usually just tell them, look, what I can't guarantee you perfection. But what I can guarantee you is that I can guarantee that I'll be trying my best in doing this restoration for you. That's all I can give you. And you know what? When you tell them that, what more can they ask for?
Yeah.
Exactly. People just want your best.
That's perfect.
So I think that's another tip, I guess. Yeah.
Perfect. So how I like to kind of wrap these things up is just to line it up with a little bit of a rapid fire. So we'll get into that. So what's your favorite pizza topping?
Meat lovers.
And what's your favorite musician or artist or band? I
don't have anyone actually. Maybe I'm in the era. I love Ed Sheeran.
Ed Sheeran? He's not bad. I like him.
Yeah. It's not so old, eh?
Yeah, no. He's what's one procedure in dentistry that kind of makes you question your career choice?
Wisdom teeth extractions.
Yeah. What's your favorite tooth to work on?
Favorite tooth? 1/6.
1/6? That's actually a common answer. And what is one procedure if you could do, you'll just do that for the rest of your career and that's it?
One procedure, just on lace.
On lace? And, and finally, if not dentistry, what career would you be in?
I already think I've told you already. Economics.
Economics. Perfect. Dr. Anthony Mack, thank you so much. It was a great interview. I think we actually got a lot of valuable information and jam-packed with value in there. So I think it'll be a popular episode, and a lot of people get a lot of useful tidbits to kind of pick up and hopefully help out in their career as they kind of progress, from year to year, and hopefully try and emulate some of your success going forward.
Look, at the end of the day, I'm just your local GP, happy to help. And, like I said, I always talk too much. So hopefully people got something out of it. But thanks for having me on.
Yeah, that's great. Thank you.
Cheers.